lack of funding, lack of funding, lack of funding. We really need to get more funding from the state bodies around the globe. And to do that, we actually do this conference to highlight the need of more research, but also to highlight what we actually have, because we have much good research, I must say, despite the lack of funding.
Many of the traits and conditions that we study are perceived to be normal processes, which they are, things like menstruation, things like menopause. They're not disease focused per se, but the impact on women's lives, on disease processes is quite extensive.
For me, it's having better evidence about the safety and effectiveness of medications in pregnancy so that women get the best treatment and they and their offspring are safe.
Mouse and humans are quite different, for example, in terms of reproductive tissues, which really then makes it more difficult for us to study it, because then we require the human as a model to get further insights into women's health. And so far, a lot of the models or the in vitro models are emerging, but they are not as complex as one will need to study women's health.
We really need to highlight the importance of research within the field of women's health. Most of the research has been done in men. We really need to understand what is happening in women.